Welcome to the world of cardiology, the study of the heart. This is Dr. Jaitly. I'm going to be talking to you about in this section chiefly what is angina. Now, it's a common symptom that normally many of us will experience past the age of 40, 45. That's where angina starts to manifest. Angina is a constellation of symptoms. Remember, it's not just one symptom. But it includes chest pain as one of the symptoms, occurring as a result of a lack of oxygen to the heart. Remember, heart supplies the body. Heart is a circulating pump. We've discussed that on previous presentations. This is the exterior of the heart. This is the interior of the heart. The left ventricle is here, which is the booster chamber out of the entire 4 chambers we have. When you look at the inside of the heart, the aorta is the big artery or the hose that's coming out and carrying fresh oxygen to the rest of the body. The first couple of branches that come off the aorta are the coronaries. One is the right coronary and the other is the left coronary, and these are the heart blood supply system. In other words, the heart supplies the body, but heart has its own supply, and that's what I'm implying is these are the coronaries which are supplying the heart. So any diminution or any decreased blood flow through any of these coronaries, or if there's an increased demand by the heart for any reason, like overexertion, stress, mental or physical, or anything that requires increased oxygen, like severe infections, for instance, or when the body is going through a metabolic change where the oxygen is required to be delivered at a higher level to the various organs, including the heart. So a combination of the above, that will result into angina or a chest pain and a constellation of symptoms. Usually the chest pain is in the middle of the chest near the breastbone or right underneath. It can radiate to the jaw, the arms, etc. But it lasts normally 15 to 20 minutes and gets better at rest. So in other words, if the person was exerting or walking upstairs or going up the hill, going up an incline and experiences this constellation of symptoms called angina, one should be aware that immediately he or she should sit down at nearby a stool or a step or a bench, etc., and rest. And hopefully the pain will get better. But do call for the nearest doctor or the nearest hospital for further evaluation and treatment. Sometimes the pain will, if the person is carrying a nitroglycerin tablet, has been prescribed by a physician, the person can put that tablet under the tongue and the symptoms will resolve. If they don't resolve, you should still go to the doctor, but if they resolve, still notify a doctor and let them know that there is a symptom called angina that you experienced. These are very alarming symptoms again because obviously they are occurring in the setting where there is either an increased demand for some reason that the heart is experiencing is not getting enough oxygen, either because of the increased demand or because of decreased flow through any of these coronaries. Thank you for your attention. I appreciate your interest in your studying the heart with me. Hopefully you understood what angina is, and we'll discuss more as in our next presentations very shortly. Thank you again. Looking forward to meet you again. Bye.